Good evening, Nigeria. Welcome again to Politics on Sunday. I am Femi Akonde. Well, today we'll talk health. The Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, has said the federal government is repositioning Nigeria's public health system to effectively detect and respond to disease outbreaks, strengthen preparedness, and safeguard Africa's largest population from emerging global health threats. Professor Pate said these about the ongoing health security reforms in a broadcast on his microblogging platform handle X, where he emphasized that the Nigerian Center for Disease Control and Prevention is being equipped to become a global reference point for disease surveillance and response. According to the minister, the leadership of President Bola Tinubu has been instrumental in driving several breakthroughs in Nigeria's health sector. While joining us live in the studio to give perspective to these reforms in the health sector, especially strengthening Nigeria's response to disease control, is the Director General of the Nigeria Center for Disease Control and Prevention, Dr. Jide Idris. Hello, sir, and welcome to the program.
Thank you very much. Good evening to our viewers.
All right, indeed. Well, let's start with, these whole reforms now we're seeing in the health sector, particularly NCDC. With the Ebola outbreak and including the COVID-19, these exposed the weakness of Nigeria's health system and also created that groundswell of advocacy for the need to immediately begin to reform and build the system against of a future reoccurrence of any of such outbreak. But how has the system been, strengthened? How has resilience been built over time, especially in the 2 years of the Tinubu administration?
Like you rightly said again, let's going back to history. The experience of Ebola and COVID woke us up as a country. And that's actually what gave birth to NCDC. And I must say again, since that time up till now, my predecessors, the three of them, have tried their best to build up on on the system.
Indeed.
But in the last 2 years, the president has been very, very focused. He has taken health as a priority. And linking that again to the minister's
broadcast.
Not in broadcast now, the plan before, in creating the health sector renewal initiatives, creating the 4 pillars. And health security is one of the pillars. And the essence is that, and what is the role of health security? To protect Nigerians, the entire population, from infectious disease. And if you cannot protect enough, from able to detect it quickly and respond, so that at the end of the day, we do not have the negative effects that this is having. And the past 2 years, like I did say, the president has is trying his best to focus on health, and we are getting more support, although we could get much more.
Okay.
And if you look at the role of NCDC itself, and our areas of operations are just 4 too. We do prevention. The best way is to prevent disease from occurring. And that's the easiest way. And again, when we first came again, that has been the weakest link in that route. So the focus has been on disease prevention. And the other with is early warning systems and surveillance. Basically, if you cannot prevent diseases occurring, you must be able to detect what it is, we must be able to find out what it is, and what we do is we go through all sorts of data, go to the committee from different sources, analyze the data that shows you the occurrence, the number of cases, what is happening and where it's happening, and the next phase is to detect using laboratory systems. Mm-hmm. And once we've detected, you must be able to mount an effective response. But rather, you don't wait for these diseases to occur. You have to prepare. That is emergency preparedness and response. So that unlike what happened in Ebola and COVID, this one we needed to prepare. And in preparing again, it goes through a whole gamut of things. You have to do risk analysis of vulnerabilities. What is our population vulnerable to? And these are different in different states. What are the risk profiles? What are the kind of hazards? And right now again, this disease occurrence can be caused by many things. It could be biologic, like infectious diseases. It could be environmental, rainfall, heat, air pollution, etc. They all affect all these things again. There could be many things, and it could even be due to sabotage or terrorism. Yeah. Exactly, because people can manipulate all these things. So, as a system, we must be prepared. And in preparing, the essence is to build the necessary infrastructure, we call public health infrastructure, that you need boost again to make that system sustainable. One is infrastructure. One has to be leadership and governance, which is what the minister has been doing. I know in the past, again, we've always described the health system in Nigeria as fragmented. Once you have fragmentation, no governance, there's chaos. The plan is to bring chaos into the system. So in disease control too, there's need to bring bring some leadership and governance. Yeah. So you have roles, the roles that NCDC plays, you have roles that state government plays, you have that local government plays, and of course the people themselves have their own role. And there are systems that are put in place again. So that's one, that's leadership and governance. Okay.
Sorry, just hold your thought a bit. Speaking about leadership and governance, and like I said in my intro, that the minister, gave a broadcast on the microblogging site X. Yeah. Let's get some excerpts from that broadcast by the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate.
Responsibility for the mobilization of as much domestic resources to protect Africa's largest population and to stay perpetually ahead of the curve. And this we are doing. The federal government of Nigeria, through the Nigeria Center on Disease Control, led its by Director General Dr. Jide Idris, has already commissioned the Integrated Disease Reference Laboratory in Lagos for neglected tropical diseases, malaria, fungal diseases, and others. The NCDC has expanded diagnostic access with new Mpox and Lassa fever labs, optimized existing laboratories in 13 states, all while reducing the turnaround time for outbreak confirmation and case classifications down to 24 to 48 hours because of an effective interstate transportation system and network. Having achieved the globally reputed ISO 15189 accreditation for the National Reference Laboratory and a 5-star rating for the Central Public Health Laboratory, Nigeria, through the NCDC, has developed a laboratory data management system which shows the dashboard of specific epidemic-prone diseases for immediate notification as well as strains identification. Disease surveillance and response would be entirely untenable without institutional coherence between federal and state entities in the sector. And this is why the NCDC operates effectively within the sector-wide approach framework of our ministry. This has facilitated the NCDC's institutionalization of monthly surveillance and outbreak review meetings to support timely outbreak analytics and system improvement actions. The framework has been recognized by the World Health Organization as a global model for early action review based on implementation evidence that has been generated here in Nigeria. Furthermore, our NCDC has operationalized the Nigeria Preparedness and Readiness Alert System, MPRAS, a predictive risk-based platform for decision-making while conducting structured risk assessments already in 8 vulnerable states to inform subnational hazard profiles and achieve alignment. In terms of outbreak preparedness, under the President's leadership, the NCDC has recalibrated fully the distribution of consumables and medical countermeasures across all the 36 states and the FCT before epidemics get out of hand, and using our existing epidemic calendar system. With our teams having been thoroughly tested during real-time coordinated responses to outbreaks such as Lassa fever, cholera, diphtheria, and others, we have assessed the effective deployment of the National Rapid Response Teams to 15 states, even as we have so far trained 272 emergency responders in simulation-based trainings. The NCDC, under the coordination of our ministry, is not resting on its laurels. We're preparing Nigeria's dedicated group of outbreak responders with advanced training, and I am pleased to report that we have delivered 4 cohorts of public health emergency management intermediate courses training for over 100 responders. In fact, over 325 infection prevention and control focal persons from 95 tertiary hospitals, 214 secondary facilities, and 16 private faith-based.
Welcome back. Well, it's good to see that, all of these reforms is happening in the NCDC, and Nigerians are getting that assurance that indeed the NCDC is prepared for any outbreak. But let's talk about the National Genomic Surveillance Strategy, which, it says here that this strategy aims to establish robust laboratory networks, build a skilled workforce, improve data sharing, enhance coordination, and all of that. How robust now, or how holistic is this particular strategy in NCDC's operation?
Well, like I said earlier, surveillance is key. You track disease occurrence. Now, we use different methods before, which is still ongoing. Hospital records, population stories, the media, we use laboratory records. But now, we're using technology again, going beyond this innovation again, going to genomics, which is addressing the DNA constituent components of this disease. If we track the genomes or genes of this particular disease, you can easily know precisely what is occurring. You can characterize what it is. So you understand me? So that is what we are doing. We're now using that genomic technology to address all diseases. Unlike before, COVID started, but now we have many diseases. You have Lassa fever, Mpox, etc. Genomics can be used because each one of them, like organisms, they contain genes. If you study the genes, you can easily know, using this technology, what is happening, what is causing this.
And how to prevent it.
Once you know what is causing it, you can decide how to prevent it. That's one. Two, you can also characterize, again, like, remember COVID now. COVID is still in existence, but there are different variants. With genomic technology, again, you can know which variant is occurring now so that you can address that. It's the same thing you do for different diseases. Once you can characterize, you can detect if you're able to respond appropriately by either treat or respond and plan against the thing spreading. See, that's what the technology is all about. But the other things he mentioned are the whole gamut of emergency preparedness, including genomic sequencing. You understand me? Take, for instance, when Mpox, we're able to detect. You can detect in Lagos, you can detect in Abuja. But with the borders, again, Cameroon, you have Cledon, you have Clade 2. Clade 1, we don't want to come here. So the essence is to optimize the laboratories around that part of the country so that it boosts their detection capabilities. So generally, like say, build infrastructure. You understand me? Laboratories, we increase our laboratory networks. Like rightly said, laboratory networks, both in Abuja as national reference labs. We're also doing now zonal labs. We have state labs again, within state labs again. So it's more like a network of laboratories that are capable of addressing different scopes of diseases, so that you don't necessarily have to start bringing everything down to Abuja or Lagos. You can do a bit at the various states. At the same time, again, the transport system for the samples. If you build also laboratories that provide them, all of them don't necessarily have to come to Abuja here. They can easily be detected. It's those ones that they cannot detect, they don't have the technology, they bring to Abuja. So at the end of the day, you build workforce capabilities. We train our staff. And in health security, there are different competencies required. You need epidemiologists, laboratory technologists, data managers. In the context of One Health, again, you have people in the Ministry of Environment, Ministry of Agric, and Animal Health. I have disease of animals that now affect human beings, both what we call zoonotic disease. And most of the diseases we are seeing are disease of animals. Lassa fever, even Ebola, COVID, all those things. These are animals again. So we need to look at all this in the context of a One Health system, so they don't look at just health again. Look at the environment, look at the various causes of it, and address this. So human resource issues, laboratory capabilities. Now, preparing to respond, you start planning ahead using the seasonal calendars. You know when diseases occur in different parts of the year. And once using all the technologies we have again, you can now start planning. Take, for instance, in the next 1 or 2 months, we're going to start expecting Lassa fever, yellow fever, meningitis, because now that's the hot seasons are coming up. We need to start preparing now. And when we start preparing now, how to talk to the public, how to stockpile the things you probably will need when this thing starts occurring, how to train your people, workforce again, in case this things occur. So that's what at the national level. But more importantly, a lot of these things happen at the state level, sub-national level. So our priority now is to develop those capabilities at the sub-national level. That's the focus now. We're working on a template.
That's including the primary healthcare?
local government, primary healthcare system. We work the states have capabilities, local government have capabilities. But we need to develop those framework for them to be able to develop, they need to plan for emergencies, they should be able to assess the risk in the various states, create the emergency response plans, build the capability so that you don't necessarily have to be waiting for us again to go there. And they can start something before we get there with this. So it's a whole gamut of things, but it requires a broad base of things, prevention aspect. And prevention now is not much more than saying, oh, you're sending leaflets. You need to do community-based prevention aspect, community engagement. You need to involve the community. We are working on a project now on COPE, Lassa fever, in one state, working with the community, using the community resources to be able to address this. Because there they have their culture, they have their tradition, you have people who know that. If you don't understand those, you may not be able to prevent this. You may be able to convey to them again the risk profile. There you know what the environmental practices are, health-seeking behaviors, environment again. So what we discover is very huge. We need to now address different diseases again. So it's a whole gamut of prevention, surveillance. Surveillance is data. Right now we're going to use innovation, digital technology, to be able to now track and predict using all this data again, big data, to be able to know precisely before you go to detection. Then you have environmental surveillance again. So you have a lot of things that are putting everything together to help us build a sustainable system so that at least address the health of the nation, of the people of this country.
I remember, during the COVID, including Ebola, contact tracing was really a big challenge, especially, in far-to-reach areas. But how has the system now improved to simplify contact tracing? It's not just Ebola and COVID that are infectious diseases. We have some of these outbreaks too that, are quite infectious, and you have to do a lot of contact tracing to help control the spread of this disease. How has it been simplified?
Well, it depends on the disease, but again, it's also related to creating awareness. People should understand the risks involved. People should understand how the diseases occur, how they are spread, either by respiratory, by touch or that kind of thing. Once you can get that to the people, you bring that to the bureau of the people. Now you cannot tell them again what to do and what not to do. That if you find somebody with this particular symptom, it can be many things, but again, seek advice from a health facility. When you get to the health facility, once the people conform to those symptoms, they become suspects. And once they move again, suspects again, not trace again, the number of people they've been in contact with, even before the symptoms may occur. Once you have that suspect, you make a diagnosis, you know that this is confirmed. Maybe say X disease. You trace all those contacts again with community awareness, with health education. Then they need to know that if they don't come out, they are doing the service to themselves. Once they come out, they have the same chance of being treated, being addressed, so that they will not be listened to the population again. So contact tracing is key, and that depends on the mode of spread of this particular disease. You understand me? And again, it depends on how virulent that disease is. So it's still available to any disease, especially people of there. So contacts are key, and that's why you keep telling people at the local governments, at the state levels again, they need to have a list of contacts. Take for instance, recently we got information from UKHSA about a Nigerian that got to UK and developed this particular disease. And they had to send us again the name of the person, and now for us to now trace the contact of the people these guys are doing contact even before he left Nigeria, so that again we need to be sure that this thing is not being spread within the country. You understand? So contact tracing is key, and it's part of our surveillance system. It's part of our emergency preparedness and response systems. We build capacities, we build knowledge, we train the staff on how to do this, how best to do it. So so that while they protect themselves, we will protect the citizens.
What's the system or the framework or the structure at Nigeria's borders, really ports of entry and exit? What's the structure there to ensure that, you know, when all of these kind of diseases or people coming into the country do not come with some kind of strange diseases and then come and start spreading it?
Luckily, again, by what they call a global health collaboration, we share data globally. So if there is any disease occurring outside of this country, and they feel that disease has potential for full spread, they notify all countries. So what the port health services do, I mean, what it does is that they are aware of this. They also get information on this surveillance things again, the kind of disease again, and then now make preparedness. I mean, preparations to be able to prevent this thing from coming in. The essence is to detect when this thing comes in, because you don't know who's who. So once they tell you this kind of disease, you know how to detect it. First of all, again, before they come in, the problem was to fill some form, some information related to the kind of disease, the age, the kind of symptoms and all. These are the things they gather again, and once they come in again, once they collect that again, they can address those people coming in, not to quarantine them, I need to confirm that they have or they do not have this disease. If they have disease and we know it spreads, they can put in quarantine. You understand me? And once they come in like that, they notify all the other states to be prepared for this kind of thing. And though they have data issues, they have forms where they take all this data information from the various states. They can even test they do temperature test or whatever it is again, just to confirm that, oh, this person or this people have these symptoms or not. If they have the symptoms, they can put again that be investigated further, either by sending them to laboratory at the airport if there is any, or the nearest laboratory, polyclinic laboratory, either in Lagos or nearest to the airport. Once it is confirmed, they are treated. Either they are quarantined if it's effective, or they are given proper treatment again, and now they follow them up, just in case they have contact with that. So it's a combination of things. It's a collaboration. They do their bit, ensuring that people who come in are screened so that we know which diseases are coming, which diseases are not coming. Once they know, they inform again the entire nation again, all the other states, the federal government, they now prepare in case they start preparing, in case there's an occurrence there. So everybody starts, it's more like detection, detective cases. We start looking for cases, similar cases of people's symptoms, people with symptoms similar to this kind of disease, and now subjected to diagnosis, the laboratory systems again.
Okay, you know, you talked about the integrated disease reference laboratory, but it seems that, you know, we don't have a lot of these around the country. There are still some cases that would need to be brought to Abuja or maybe Lagos. We don't have a spread of all of these. What kind of investment now is ongoing to ensure that we begin to have more laboratories with high-powered capacity to improve testing and to also reduce, you know, time and help improve response?
That's why we said optimization. And like I did say again, you have a network of laboratories. All the laboratories cannot be at the same level of competence and capabilities. One, because you require the resources available, you require the equipment, and you require the technology again. The kind of laboratories we have in Abuja are here. They are done in such a way that because they handle, they call high consequence pathogens, that's BSL-3, BSL-4, apart from the normal ones. So what we do is you start to build capacities locally. Maybe right now, you know, before when COVID started, everything was just one disease, everyone was attacking. Now we are building those capabilities. You can test for different, or look for different diseases, depending on the capabilities you have. Because for this disease, you have different requirements. You may have specialists. I mean, take for Ebola, for instance, there's people who specialize in Ebola. There are people who specialize, you understand me? And it's not all the same that we have those specializations. Even in Nigeria, I think there are very few. Are you with me? But again, if you can build the capacity for those laboratories at the periphery to be able to take care of more than one disease, that's why it's integrated. Because the system is slightly similar. Whether it's COVID, whether it's Lassa fever, whether it is, you still go do surveillance, detection, and this thing. Is the modalities that are different. But again, if you have that basic framework in place, it's easier to be able to address these things.
All right, then. Thank you so much, Dr. Jide Idris, Director General, Nigeria Center for Disease Control and Prevention. Thank you for your time on the program, sir. Well, that's it on the program today. At the top of the hour is TVC News flagship bulletin featuring the Sunday special. Thank you for watching. I am Femi Akonde.